I think you'll know who I'm referring to. Leveraging social media. What are some of you mentioned two things, keeping a personal and a private, public and a private, but are there other tips in terms of using social media to get your work out, and how do you manage the risk of spreading yourself too thin?
I think as far as trying to make sure that your work is more widely disseminated, make sure that you are engaging with with practice groups who will also be on those social media networks, and make sure that almost anything that you do put carries an appropriate hashtag, because then that goes directly to a huge audience that goes way beyond your usual group of followers or practice community. So that would be one of the key things to doing it. As far as spreading yourself too thin, do you mean getting your work out there before you want it?
In terms of getting so much response from different persons that you can't actually address everybody's query.
I think I would take that as a compliment that you're doing the right thing. I think the more people who engage with your work, the less likely it is you'll be able to engage with each of them individually. But not everybody will ask you something completely different, and you'll be able to do something like a general thank you and then respond more generically. Or if you're keeping a blog, refer them to a blog post that you might do, or if you've had articles published, refer them to the articles particularly, and it's where something like the university's institutional repository is extremely important to make sure that in effect you're using it as an advert for yourself.
I'd like to thank all the speakers because you have done a very good job, everyone. Then I'd like to go straight to Dr. Holly. I think you spoke about writing lives, community-based projects, and all of that. That's quite good. And I discovered that you use poetry, which is a yarn, and all of that. But I don't know whether you have considered that you could also use theater. I come from a background of theater, and from what you have spoken, I know the impact of theater in community relations, especially this model that you are using. When you do that, it brings about more participation, and it also helps the project better because there will be role-playing. You understand what I mean? You can make use of role-playing, you can make use of songs, spectacle, and all of that. And that model becomes more interesting. And you discover that you are likely to even get better results. So I don't know whether in the nearest future you're also considering using theater as part of your tools for this kind of model that you are using.
Well, it's a great idea. I think any kind of creative expression is valuable, and what you say with theatre is that you're getting even more explicit engagement because it implies audience as well, and I think that's a great idea. I mean, two things. Obviously, funding is a restriction that at the moment we don't have the expertise in-house, as you like, to do that. But secondly, it's also, is that what the participants want to do? And at the moment, I think maybe they're not quite ready for that kind of performance. I think they really appreciate the intimate, safe space that we have created for their first steps into creative practice. But for the future, it's a wonderful idea, and I thank you for it, and it's something we will certainly think about. Yeah.
There are two strands, both very interesting to the conference, one being theory and one being impact. And I wonder if the two can't possibly be at odds with each other. And this is a question for anyone, but as an example, if we take the study of football fans and the police, if you were to do a theoretical study into the representation and othering of the fans on the part of the police, it's a very theoretical but very interesting study, but very difficult to quantify impact. So can the two be at odds with each other? For anyone.
I'll just answer that one very quickly, because my co-author, Jeff Pearson, who's based at Liverpool University, has conducted a very long ethnographic study of football fans and has got that theoretical grounding. My background is much more criminal law, so I provide the legal input there. So, although it can be more difficult, I don't think it is. I don't think they are necessarily contradictory, because the theory helps to provide an additional level of understanding of what it is that you're looking at. So that I find it an absolutely necessary part that we're using the empirical ethnographical study and a more traditional criminal law analysis of a situation to be able to provide appropriately contextual advice to the people who are actually engaged with these issues.
Would anyone else on the panel like to talk about divergence between theory and impact?
I think in my area, I guess creative writing is a relatively young academic discipline, certainly in this country, and so we find the theory is emerging, and certainly in my experience is that the kind of the doing and the theorising almost feed each other, and so it's very much a symbiotic process. So in my own experience, I haven't yet encountered a tension, but I appreciate that that could happen, yeah, by all means.
Thank you. We've time for one more question, please. So I will take two if they're quick. So
it's about ethical approval, and particularly Dr. Hurley and Dr. Williamson. It must be an interesting area in terms of ethical approval. So let's make it very quick. Could you just outline your approach in that regard?
Well, with ethical approval, I mean, the bottom line is simply that it is directed by the participants. They tell us what they want to do. We simply provide the funding, the environment, the facilitators, and everything else is down to them. But obviously, there is, of course, as researchers, we're very much aware of ethical approval requirements and ethical research. It's always there in our minds, but it really hasn't been an issue because we've just always said the ownership is with those participants, and we respond to their express need. It's not a case of us kind of doing things to them. So it hasn't come up yet, but it's something we're aware of.
In terms of ethics of the public involvement, this used to be very much a grey area that a lot of people asked about, so we had to develop guidance on it. I used to be a member of the Involve Advisory Group I mentioned earlier, and they now have guidance on the internet that's available. I can give you the link afterwards, which makes it very clear that when the public are just involved in, say, advising, sharing their ideas, that kind of thing, there's no need for certainly NHS ethics approval. It's only when they become participants, i.e. when they have access to raw data, or whether they're being interviewed or the research is being done on them, that's the only time you need ethical approval. So up until that point, anonymised data, not a problem. To get the hands on transcripts and it's identifiable who the person was, that is a problem. But there's a very clear statement developed by Involve and the National Research Ethics Service that clarifies it for people. And the University Ethics Committees are very much aware of that guidance as well. So you'll have a good reception if you want to do public involvement in your work when you apply for approval here.
and one final question, please.
Yeah, it's just a general question for the panel. It all sounds very positive when you're talking about the impact, and it's obviously really positive outcome. What about groups that might be negatively impacted? So when you start to map out what the impact of the research is there consideration for negative outcomes?
I can start to answer that one if you like. One of the things I just mentioned quickly at the end was about managing expectations, and I think it's very important to have a conversation with people at the beginning about what you can promise and what you can't promise, and generally speaking that you can't promise anything because the world can change, you can move jobs, you can be headhunted somewhere down the road, things change, people change. So I would say very early on in your engagement, discuss those issues, see what people's expectations are, and if you can, try and realise them, which is the appropriate thing to do. But also warn them, perhaps have some ways of working agreement, or ground rules is another phrase, to actually get people to realise that there might be a negative impact. So for example, one of the members of the public I engaged with loved being involved in the research project, and I knew to gradually debrief towards the end of the project as it was looming, so people didn't feel dropped off the end. But she wanted to go on and be involved in further research, and I couldn't find her any. I tried everywhere, national colleagues that I had contacts with, locally, but just couldn't find it, and she just felt abandoned despite best efforts. So that's my response.
Richard, would you have anything to say?
Yeah, I think we've actually done work in conflict-affected environments where you can end up with clearly a situation where you might, some of the work you do might advantage one group and disadvantage another. But we've actually used a technique called do no harm, which there's a do no harm framework, which sets out an approach for, I suppose, managing your interventions to ensure that they you consider what impact you might have on different groups, and that you can take mitigation strategies and so forth to ensure that you don't have a negative impact or inadvertently affect a group in a negative way.
Thank you. Would everyone please join me in thanking our speakers today?